Well, NCDs are indeed a growing problem. Non-communicable diseases, commonly referred to as NCDs, such as diabetes, musculoskeletal disorders, cardiovascular diseases, are generally on the rise. The reason they're on the rise has to do a little bit with our life expectancy, which has increased dramatically over recent years. We're now on average at about 80 years in many countries. Now, longevity comes at a cost, with quality of life and healthcare costs. Well, diet and nutritional needs are very important, and particularly for the more vulnerable populations, such as older people or aging adults, as we commonly refer to them. WHO, the World Health Organization, considers nutrition as one of the key factors in order to improve health and quality of life when aging. Well, nutritional shortfalls for older adults and patients are pretty difficult to address, and that's a common fact. We can agree with that. The reason why it is difficult is that when you age, you have a number of changes. Dietary habits change, food choices change, but also physiological changes such as difficulties with swallowing or digestive problems do play a role. As a result of that, nutritional intake and nutritional status will normally reduce, and as such will potentially cause a problem for older adults. The most critical nutrients for the aging populations are, among others, shortfalls in calcium, vitamin D, vitamin E, magnesium, potassium, protein, zinc, omega-3 fatty acids, and fibers. And there are a number of short and long-term studies that clearly show that if you have an adequate intake of those essential nutrients, you will improve quality of life and health. So DSM Medical Nutrition Solutions address the needs of elderly in two ways. We designed them in order to make sure that they address the nutritional needs, but also the physiological needs of the aging population. The medical nutrition solutions that we develop are particularly designed to make sure that we increase the nutrient intake, taking into consideration their specific conditions, and as such improve the quality of life, which is most important, but also enable to reduce the burden of healthcare costs.